Question: which of the following does not increase absorption of iron? Options: A. Amla, B. Citrus fruit, C. Sprouts, D. Curd. Correct answer is option D. Curd. Amla, citrus fruits and sprouts increase iron absorption due to their vitamin C content. Curd contains calcium which inhibit iron absorption. Question: conditions seen in anorexia nervosa include all of the following except options: A. Osteoporosis, B. Myocardial atrophy, C. Electrolyte imbalance, D. Menorrhagia. Correct answer is option D. Menorrhagia. In osteoporosis, due to hormonal imbalance and calcium deficiency. Myocardial atrophy, it occurs because of severe malnutrition. Electrolyte imbalance, common from vomiting, starvation or laxative abuse. Menorrhagia, not seen. Instead, patient develop amenorrhea due to low estrogen level. Question: what is the criteria for low birth weight baby? Options: A. Birth weight less than 2 kg, B. Birth weight less than 2.5 kg, C. Birth weight less than 3 kg, D. Birth weight less than 1.8 kg. The correct answer is option B. Birth weight less than 2.5 kg. According to WHO, a low birth weight baby, that is LBW baby, is defined as one with a birth weight less than 2.5 kg or 2500 gram regardless of gestational age. Very low birth weight or VLBW is less than 1.5 kg and extremely low birth weight, that is ELBW, is less than 1 kg. Question: the mechanism of action of copper T is options: A. Prevent ovulation, B. Prevent fertilization and implantation, C. Kill sperms in the vagina, D. Causes tubal blockage. The correct answer is option B. Prevents fertilization and implantation. Question: the contraceptive effect of copper T is mainly due to A. Release of estrogen, B. Release of progesterone, C. Release of copper ion toxic to sperms, D. Mechanical blockage of cervix. The correct answer is option C. Release of copper ions toxic to sperms. Question: the duration of effectiveness of copper T 380A is options: A. 1 year, B. 3 year, C. 5 year, D. 10 year. The correct answer is option D. 10 year. Question: a common side effect of copper T is options: A. Amenorrhea, B. Menorrhagia and dysmenorrhea, C. Weight gain, D. Acne. The correct answer is option B. Menorrhagia and dysmenorrhea. Copper T often causes heavier and longer menstrual bleeding, that is menorrhagia, and painful menstruation, that is dysmenorrhea, especially in the first few months after insertion. Other side effects may include spotting or irregular bleeding, but amenorrhea, weight gain and acne are not typically side effects of copper T, which is a non-hormonal IUD. Question: copper T is contraindicated in options: A. Nulliparous woman, B. Woman with a pelvic inflammatory disease, C. Lactating woman, D. Woman above 35 years. And the correct answer is option B. Woman with a pelvic inflammatory disease, that is PID. Other contraindications include pregnancy, non-copper allergy, Wilson disease, distorted uterine anatomy and active genital infections. Copper T is generally safe for nulliparous woman, lactating woman and woman above 35 years unless other contraindications are present. Question: the hormonal IUD Mirena releases which hormone? Options: A. Estrogen, B. Progesterone or levonorgestrel, C. FSH, D. LH. And the correct answer is option B. Progesterone or levonorgestrel. It works locally in the uterus by thickening cervical mucus, thinning of the uterine lining and sometimes suppressing ovulation to prevent pregnancy. It does not release estrogen, FSH or LH. Question: the duration of action of Mirena is about options: A. 1 year, B. 3 year, C. 5 year, D. 10 year. The correct answer is option C. 5 year. Question. Compared to copper T, Mirena is most likely cause options A. Heavy bleeding, B. Amenorrhea, C. Dysmenorrhea, D. Pelvic infections. Correct answer is option B. Amenorrhea. Question. The best time to insert an IUD is options A. During menstruation or immediately after it, B. During ovulation, C. During pregnancy, D. 2 weeks after menstruation. The correct answer is option A. During menstruation or immediately after it. Question. Mirena prevents pregnancy primarily by options A. Stimulating ovulation, B. Thinning of endometrium and thickening of cervical mucus, C. Increasing sperm motility, D. Neutralizing uterine pH. And the correct answer is option B. Thinning of endometrium and thickening of cervical mucus. Question. Hormonal IUDs like Mirena are not recommended in options A. Breast cancer patient, B. Woman with a copper allergy, C. Woman with a dysmenorrhea, D. Woman after cesarean section. The correct answer is option A. Breast cancer patients. Key tips for exam. Copper T causes menorrhagia and Mirena causes amenorrhea. Question. Multiple sclerosis is primarily a disease of the options A. Peripheral nervous system, B. Autonomic nervous system, C. Central nervous system, D. Neuromuscular junction. The correct answer is option C. Central nervous system. Multiple sclerosis causes demyelination in the brain and spinal cord, that is CNS. Question. Classic early symptoms of multiple sclerosis is option A. Ptosis, B. Optic neuritis and visual disturbances, C. Muscle wasting, D. Facial drops. The correct answer is option B. Optic neuritis and visual disturbances. Visual problems due to optic nerve demyelination are often the first signs. Other early symptoms include numbness, tingling, muscle spasm and fatigue, but optic neuritis is particularly recognized as a classic early manifestation. Question. A diagnostic finding in multiple sclerosis is option A. Decreased CSF protein, B. Oligoclonal bands in CSF, C. Elevated serum calcium, D. Low glucose in CSF. The correct answer is option B. Oligoclonal bands in CSF. Oligoclonal bands, that is OCBs, represents intrathecal IgG production and are present in about 95% of multiple sclerosis patients, serving as a gold standard laboratory diagnostic marker. Question. The most common type of multiple sclerosis is options A. Primary progressive, B. Relapsing remitting, C. Secondary progressive, D. Progressive relapsing. The correct answer is option B. Relapsing remitting type, that is RRMS. RRMS, that is relapsing remitting multiple sclerosis, is characterized by episodes of symptoms flare-ups, that is relapses, followed by periods of partial or complete recovery, that is remission, distinguishing it from the progressive form of multiple sclerosis. Question. Which multiple sclerosis type begins with relapses and remissions, then gradually worsens without distinct attacks? Options A. RRMS, B. SPMS, C. PPMS, D. CIS. The correct answer is option B. SPMS, that is secondary progressive multiple sclerosis. SPMS, that is secondary progressive multiple sclerosis, typically develops in people who initially have relapsing remitting multiple sclerosis, that is RRMS, and is characterized by a steady progression of neurological damage with or without superimposed relapses, minor remissions or plateaus. In SPMS, the cycle of distinct relapses and remissions fades and symptoms steadily worsen over time. Question. Which form of multiple sclerosis is characterized by steady worsening from onset without relapses or remissions? Options A. RRMS, B. PPMS, C. SPMS, D. CIS. The correct answer is option B. Primary progressive multiple sclerosis, that is PPMS. In PPMS, symptoms continuously progresses and patient do not experience defined attacks. Instead, functional decline is gradual and continuous from diagnosis. This type typically accounts for about 10 to 15% of multiple sclerosis cases. Question. The first episode suggestive of MS lasting at least 24 hours is called options A. Relapsing remitting MS, B. Clinically isolated syndrome, C. Progressive relapsing MS, D. Subclinical MS. The correct answer is option B. Clinically isolated syndrome. CIS refers to a single new episode of neurological symptoms that are the first clinical signs of possible MS but do not fulfill the full criteria for a diagnosis of multiple sclerosis. Question. Which of the following statement about relapsing remitting MS is true? Options. A. It affects both men and women equally. B. It shows continuous progression without remission. C. It is an initial course in most MS patients. D. It is always non-inflammatory. The correct answer is option C. It is the initial course in most MS patients. RRMS is characterized by clearly defined relapses of neurological symptoms followed by periods of partial or complete remissions without disease progression during the remission phases. It is the initial course in approximately 70 to 80% of people with MS. RRMS affects women more than men. RRMS does not show continuous progression without remission. Continuous progression without remission is characteristics of primarily progressive MS. RRMS involves inflammatory activity in the central nervous system, so it is not always non-inflammatory. Question. The most useful imaging techniques for diagnosis of MS is options A. CT scan, B. PET scan, C. MRI brain and spinal cord, D. X-ray skull. The correct answer is option C. MRI brain and spinal cord. MRI is the primary and most sensitive imaging modality for MS diagnosis, capable of detecting lesions in the brain and spinal cord that are characteristics of MS. It can show active inflammation with the contrast-enhanced scan and help demonstrate dissemination of lesions in space and time, which is key for diagnosis. Question. Which of the following finding in CSF supports the diagnosis of MS? Options A. Elevated glucose, B. Oligoclonal bands, C. Decreased protein, D. Increased white blood cells. The correct answer is option B. Oligoclonal bands. Oligoclonal bands, that is OCBs, in the CSF are the gold standard biomarker for MS diagnosis. They represent intrathecal synthesis of immunoglobulins and are found in the majority of MS patients. The presence of OCBs in CSF but not in serum supports a diagnosis of MS by indicating CNS-specific immune activity. Question. Which drug is considered a first-line disease-modifying therapy for relapsing remitting MS? Options A. Interferon beta, B. Prednisolone, C. Azathioprine, D. Cyclophosphamide. The correct answer is option A. Interferon beta. Interferon beta and glatiramer acetate reduces relapses frequency and disease progression. Question. Which of the following is a typical symptom of a relapse in MS? Options A. Fever lasting less than 12 hours, B. Neurological deficit lasting greater than 24 hours, C. Sudden loss of consciousness, D. Headache with nausea. The correct answer is option B. Neurological deficit lasting greater than 24 hours. Relapses in MS are characterized by new or worsening neurological symptoms that last at least 24 hours and are not associated with a fever or infection. These symptoms often develop over hours to days and can persist for days to weeks before improving. Question. Which vitamin deficiency is associated with an increased risk of multiple sclerosis? Options A. Vitamin A, B. Vitamin B12, C. Vitamin D, D. Vitamin E. The correct answer is option C. Vitamin D. Low vitamin D levels are linked to a higher risk and severity of MS due to its role in immune regulation.